today to talk to you about mastitis. Mastitis is a common bacterial infection that causes inflammation to the mammary glands and the breast tissue. 1 in 4 breastfeeding moms will experience mastitis throughout their breastfeeding journey. What we want you to be able to take away from this video is to recognize early signs and symptoms of mastitis so that you can seek treatment earlier, which will promote faster healing. Some of the signs and symptoms that you may experience with mastitis are redness to the breast tissue, a hard and painful lump, red streaking from the nipple up towards the armpit. Your breast may appear waxy or shiny as well as your nipple. You may also feel burning, pain, tingling while you're breastfeeding or pumping. And then you'll experience symptoms that are similar to the flu: headache, body aches, malaise, just not feeling very well, and a fever. When you notice any of these signs and symptoms, call your doctor and get in and speak with them so that we can get treatment started sooner. Some things that you can do at home to help with the pain are to utilize a warm compress before breastfeeding or pumping. Something similar to this, which can be warmed in the microwave or actually cooled in the freezer. And then you can take this and put it against your breast tissue right where that pain is. If you don't have a compress similar to that, you can utilize a washcloth, warm it with water, and then put it in the microwave. Although be careful when you're putting anything to the breast. You want to check the temperature first, and you also don't want to have anything on the breast when you put baby there as well. You want to make sure that baby's positioned in a way that they're breastfeeding, where their chin and nose is pointed at that painful lump. So if you're utilizing a cross cradle method and you have that painful lump on the right side, you may need to switch baby to more of a football hold where you can direct their nose and chin directly at that lump. Some things you also will do at home that can help are massaging the breast tissue to break up that clog. Sometimes utilizing your knuckles is going to be more efficient. It is painful, but you want to take your knuckles starting up high towards the armpit and massaging downward towards the nipple to help break up that clog in that duct. You can use Tylenol and ibuprofen over the counter to help with the fever and the body aches. The ibuprofen or Advil is an anti-inflammatory, and that's also going to help you a lot with that pain that you're feeling. It's important to stay rested, and that's hard to do as a new mom and a breastfeeding mom, but make sure you use your support people for that. Rest when baby rests, and stay hydrated. You also want to look at baby's latch. Baby's latch can affect mastitis and cause mastitis by damaging your nipples. If baby has too much of a shallow latch and it's pinchy on your nipple, it can crack, and that's another way that's a way that bacteria can enter the breast tissue and cause mastitis. The other way that mastitis can be caused is from milk stasis, which is where milk stays in the duct system and then creates the infection. So it's important that you're on a routine and a schedule, whether you're breastfeeding the baby or pumping. You don't want to go long periods in between those feeds or pumps, because that can lead towards that towards the milk stasis, which causes mastitis. When you're feeding baby, you want to make sure that baby's latch feels comfortable to you. You're supporting baby by supporting the head, torso, and the legs. You can utilize a nursing pillow, which will help support baby, and then that way you can get yourself in a more comfortable position. As always, before you're feeding your baby or you're using your pump parts, you want to make sure that your hands are clean before you touch your breast. You also want to make sure that the pump parts are clean and sanitized as well. After you're seen in office by the doctor or provider, they may prescribe antibiotics for you. It's important that you stay on schedule on the regimen with the antibiotics and finish them completely. In the event that you stop taking the antibiotics early, that mastitis could turn into something more serious, like a breast abscess, which would require some more invasive treatments. Breastfeeding can be difficult, but it is best for you and for baby. Your doctors and your lactation consultants and nurses are here to support you and encourage you along the way. Feel free to contact us whenever you have any questions, and we are proud of you, and keep going, mamas. You're doing a great job.